Hey everyone, and welcome back. Today we're really diving deep into a fascinating area, veterinary gait analysis. We're going to uncover how a dog's walk can actually reveal hidden health secrets. Get ready, it's more interesting than it might sound.
It really is.
So our main focus today is this 2024 research article from BMC Veterinary Research. Park and their team, they were asking a question that has puzzled vets, probably for ages.
Mhm.
Can we really differentiate between ataxia and lameness in dogs just by watching them walk?
It's a great question to be asking. See, both conditions, they affect a dog's gait, right? But they come from totally different underlying problems.
And I bet knowing the difference is crucial for figuring out the right treatment too.
Absolutely. You've got to get the diagnosis right.
Okay, so for anyone who's hearing these terms for the first time today, could you give us a quick breakdown? Ataxia versus lameness?
Sure. Ataxia, it's basically a lack of coordination. And often it's caused by some kind of neurological problem. It's like, imagine the smooth flow of information between the brain and the muscles getting disrupted. That's what causes that wobbly kind of walk that we see.
So it's not an issue with the legs themselves being weak or anything.
Right. It's more of a communication error.
Fascinating. And lameness, that's a little more straightforward, I imagine.
Yeah, lameness is basically pain or discomfort, usually in a limb, and it leads to limping. Pretty obvious when you see it.
So a lame dog is consciously trying to avoid putting weight on that sore paw or leg, whereas a dog with ataxia might be struggling with balance, like their body's fighting against them.
Exactly. And this is where gait analysis gets really cool. This particular study used a tool called a pressure-sensitive walkway, a PSW, to get objective measurements of how these dogs move, even subtle differences.
A PSW, is that like a high-tech treadmill for dogs?
It's more like a special mat, actually. Imagine a sensitive floor mat. As the dog walks across it, the PSW records all sorts of data: how long each paw touches the ground, the force of each step, even how the dog's weight shifts throughout their stride.
Wow. So they're getting a detailed map of every paw placement. That's got to be a ton of data to work with.
It is. And to make sense of it all, they use three groups of dogs. First, a control group of healthy dogs to have that normal gait for comparison.
Makes sense. You need that baseline.
Right. Then a group of dogs with confirmed hind limb ataxia.
So a specific type and probably a certain severity too, I'd imagine.
Yes, these dogs could still walk, but they had really clear coordination issues in their back legs. And to make it even more precise, they used the modified Frankel scale to be sure about the ataxia diagnosis.
And what about the third group?
The third group was dogs with lameness, specifically in both their hind legs. We call that bilateral hind limb lameness. And again, they had a range of lameness severity in this group to really see if there were patterns connected to how much discomfort each dog was in. They used a numerical rating system to assess that.
Having those distinct groups is essential, otherwise you're comparing apples to oranges.
Exactly. And that way you can actually start to draw meaningful conclusions.
Okay, so I get why they'd want to do this study, but why go to all this trouble? Why is objective gait measurement so important? I mean, can't vets usually see ataxia or lameness just by looking at a dog?
You'd think so, and often they can. But sometimes those signs are super subtle, or maybe a dog has both ataxia and lameness at the same time, which can make things less clear. This study wanted to find those hidden clues in a dog's gait and then give vets solid data, not just observation. That way, vets can be even more confident in their diagnosis.
Which leads to more effective treatment.
Exactly. It's all about getting the best outcome for the dog.
So we've got our three groups of dogs. They're walking across this pressure-sensitive mat. What did the researchers find? What were the big aha moments when they looked at all that data?
Well, one of the most interesting things was how dogs with lameness and ataxia, how they compensated differently.
Oh, really? I would thought they'd both just try to take weight off their hind legs.
You'd think so, right? But it's not that simple.
Okay, so tell me more about these different strategies. How are they compensating differently?
Let's start with the lameness group. They did what you might expect. Shifted their weight forward big time, more pressure on those forelimbs. Makes sense, they want to minimize the discomfort on those sore hind legs.
Right, of course.
And what's really interesting, even dogs with really subtle lameness, what an owner might just see as a slight limp, they were putting noticeably more weight on their front legs. The PSW picked that up.
Wow, so even what seems like a minor issue could have an impact on their whole body.
Exactly. It highlights how important early detection and treatment are. All that extra stress on the forelimbs, over time, that could lead to other problems down the line. Wear and tear on those joints.
It's like driving with a flat tire. You can do it for a little while, but eventually.
Exactly. So lame dogs, they shift forward. But here's where it gets really interesting. The dogs with ataxia, they didn't show that same clear shift.
No. So even though their back legs are uncoordinated, they're not compensating by putting more weight on their front legs. Why is that?
That is the million-dollar question. This study doesn't give us the definitive answer, unfortunately.
Darn.
One theory it could be that the neurological impairment, the thing causing the ataxia in the first place, it might actually make it hard for them to consciously adjust how their weight is distributed.
Interesting. So it's not just about strength, it's about the brain's ability to fine-tune all those tiny movements.
Exactly. And this highlights how complex this all is, the connection between the musculoskeletal system and the nervous system. We still have a lot to learn.
Absolutely. And this study reminds us of that. Now, I know this study didn't just look at weight distribution, right? They also measured things like the timing of each stride, how long a pause on the ground. What did those measurements show?
Good point. So stance time. That's how long each paw is in contact with the ground during a stride. Remember how we talked about the ataxia group, how they were unsteady?
Hmm.
Well, the data showed at those dogs, they had a much longer forelimb stance time.
Almost like those front legs were working overtime to keep them stable.
That's a great way to put it. Like, they're trying to create a solid base to compensate for the wobbliness in the back.
Fascinating. What about the lameness group? Anything interesting with their stance time?
Their forelimb stance time was pretty similar to the healthy dogs, but they were moving those front legs faster. Their forelimb stride velocity was higher compared to the other groups.
Wait, so they're spending the same amount of time with their paws on the ground, but they're moving those legs faster. That seems counterintuitive.
It does, right. But it makes sense when you think about it. Those front legs, they're doing double duty, not only propelling the dog forward, but now they're carrying more of the weight, too. It's amazing how adaptable their bodies are.
It really is. Okay, so we're seeing these patterns. Lame dogs shifting forward, ataxia dogs with that longer forelimb stance time, and the faster stride velocity in the lameness group. That's a lot more than we could ever tell just from watching a dog walk across a room.
100%. And these findings have some really important implications, not just for understanding how dogs move, but also for how we diagnose and treat these conditions. Like knowing that even subtle lameness puts more weight on those front legs, that emphasizes how important it is to catch it early.
Prevent those long-term joint problems.
Yes.
This is all so fascinating. It really highlights how much we can learn from this objective gait analysis. But before we wrap up, something's been bugging me. The study looked at so many aspects of gait, stride length, stance time, weight distribution, but there's one thing they didn't find a significant difference in: stride length. Why wouldn't that be affected? Especially in the ataxia group.
That's a great point, and it just goes to show how much more there is to learn. The study was really insightful, but it is just one piece of the puzzle, right? They focus specifically on hindlimb ataxia and lameness in a certain group of dogs. There's other research out there that has found stride length differences in dogs with different types of ataxia.
Oh.
So it could be that the specific type of ataxia in the study just doesn't affect stride length as much, or maybe with a bigger group of dogs, more diverse, a pattern would show up.
Makes sense. It's a good reminder that science is always discovering, always more questions. What about you? What really stood out to you from this research?
You know, what really gets me excited is the potential here. And not just for diagnosis, but for figuring out the best treatment plan for each dog. Imagine being able to measure objectively how a dog's walk changes with medication, or after surgery, or even with physical therapy.
It'd be like having this window into their recovery, seeing improvements you might not even catch with your eye.
Exactly. And it's not just treatment, it's early detection too. Maybe we could use this technology to pick up on subtle gait problems really early on, before they even become a serious issue.
Wow, that's incredible. Like, imagine those thermal cameras that can see heat signatures. We could be looking at a future where we can almost see lameness or ataxia before there are even any visible signs.
Exactly. And pressure-sensitive walkways are still pretty new. Not every vet has access to one yet. But research like this is what pushes the whole field forward.
It's a really exciting time to be a dog lover and a science nerd. This deep dive has been amazing, and I, for one, can't wait to see what new discoveries come out in this area.
Me too. It's really fascinating stuff.
And for our listeners who want to dive even deeper into this topic, as you know, we always love going deep, we've got a link to the full research article in the show notes. Trust me, it's worth checking out. And until next time, keep those reins engaged and those tails wagging.